In determining our vision, we can choose between easy, difficult, or even impossible visions, but the most effective leaders think beyond imagination. The World Health Organization Framework, Convention on Tobacco Control, and Empower package of interventions offer some of the most effective policy strategies that can bring us closer to the vision of a healthy, tobacco-free world. Countries are implementing these strategies, but much progress is still needed in many places. Understanding the difference between the vision and reality helps leaders plan the strategic moves and action steps needed to close the gap. One way to visualize this gap is by using a spidergram. This activity can help us meet two objectives. First, to understand the underlying reasons for the difference between the current situation and the vision. And secondly, to identify the key constraint, also known as the weakest leg, where action needs to happen first. There are 4 steps to this spidergram activity. Step 1. After reviewing your shared vision and current situation, select one area in tobacco control that you believe is a priority area requiring change. Write down the specific problem associated with this area. The World Health Organization's Empower measures highlight the key interventions needed to reduce the demand for tobacco products. These areas include monitoring tobacco use, protecting people from tobacco smoke, offering help for quitting tobacco use, warning about the dangers of tobacco, enforcing bans on tobacco advertising, promotion and sponsorship, raising taxes on tobacco. Depending on your local situation, there could be additional topics to address, such as stopping illicit trade in tobacco or ending government support for tobacco agriculture. In this example, the area of tobacco control needed urgent action is protecting people from tobacco smoke with smoke-free public places. The specific problem is that people continue to smoke in places where smoke-free laws are in place. For any of these tobacco control action areas, some essential elements are needed to achieve progress in controlling the tobacco epidemic. Step 2. Write these elements on the legs of the spidergram. Some examples of elements include sound policies, enforcement, reliable data, partnerships, communications and advocacy, public support, capacity to battle the tobacco industry, and other factors such as cultural practices and social norms. Are there other elements affecting tobacco control success in your country? If so, you may include these elements on the legs of your spidergram. Step 3. Rate the state of each of these elements in relation to your specific problem on a scale of 0 to 2 and plot the ratings on the spider web. 0 means it's non-existent or weak. 1 is partial and 2 is strong. In our example, sound policies rated a 2. Data partnerships, communications, and capacity to battle the tobacco industry all rated 1.5. Other elements rated a 1, and enforcement implementation capacity rated a 0.5. Now step 4. Connect the corresponding points across the spider web to identify the weakest leg. Notice the shape of the web. In our example, it's clear that the enforcement implementation capacity is the weakest leg and the key constraint. Here is a helpful hint. The spidergram presents a quick visual overview of strengths and gaps for each action area in a country's capacity to control the tobacco epidemic. Each Empower action area will have its own unique spidergram. Ideally, the spidergram should be stretched out completely and widely because you need all elements operating at maximum capacity for effective tobacco control. In real life, the elements or legs of the spidergram are all interconnected. Improvements in one leg have an impact on the other elements. However, the strength of the entire web is determined by the weakest leg. If unchanged, the weakest leg will cause the web to collapse, so the weakest leg represents the key constraint, where action must first be directed to strengthen the entire web. These tobacco control elements are fluid as conditions evolve and as individuals and stakeholder groups change. The assessment scores will also change. So this type of assessment exercise needs to be performed regularly to stay current. Now that you have determined the key constraint, you are positioned to move on to the next exercise to find the root causes of the constraint and solutions to overcome them.